Hi, my name is Yindia, and I'll be giving a short lesson plan presentation on the harmful effects of smoking for a town called Shadowville. I am a registered nurse in the BSN program at ECPI University. This is nursing course 443 and 444 under a J. Holland. On today's agenda, we'll be covering the introduction, the target audience of who we're going to be speaking to today, some learning objectives, and of course, our conclusion, and then the references will be at the end. Community needs. Understanding the needs of a community can allow for crucial health concerns to be addressed. In a recent community assessment of a town called Shadowville, the top 3 crucial health concerns and learning needs there were hypertension, smoking, and diabetes. This presentation today will specifically address the dangers of smoking and some strategies for prevention and cessation for this given town. Target audience. Who are we trying to reach? It is always important to provide relevant and reliable information and resources that's tailored to the specific groups who are at the highest risk for smoking. In Shadowville, those 3 groups were the low-income communities, youth age groups from the ages of 12 to 17, and the older adult working class citizens. Today, we will have 3 learning objectives: the dangers and risks of smoking and its relation to hypertension, how to identify some of the prevention methods of smoking in teens and young adults, and lastly, how to identify the reduction and cessation tools and services for smoking prevalence amongst adults. Understanding the harm of smoking. Smoking can lead to 3 serious illnesses: cardiovascular disease, respiratory issues, and of course, hypertension. Smoking greatly increases the risk of heart attack and stroke, according to the American Heart Association. The leading cause of lung cancer and chronic obstructive pulmonary disease, or COPD, again, is smoking, according to the American Lung Association. And then lastly, nicotine increases blood pressure, leading to hypertension because it causes damage to the blood vessels. And that was according to the CDC. Protecting our youth with some prevention strategies. Through the Truth Initiative, school-based education programs were designed to target and teach refusal skills and educate about the dangers of smoking. Through public media, health campaigns were used to highlight the negative consequences of smoking and in attempts to deter the youth from smoking. And lastly, they began to raise tobacco prices and have more restrictive access. Those higher purchase costs and stricter age limits, they projected, could greatly impact the youth smoking rates. Reduction and cessation for adults. They have support for quitting and tools and services. Nicotine replacement therapy, or NRT, helps with withdrawal symptoms so that they can be better managed, and you can do so through nicotine patches, gum, and lozenges. They also offer counseling and support. You have individual counseling, group counseling, and then you also have online resources to provide encouragement and guidance through your journey to quit smoking or cutting back. And then lastly, we have the quit lines. The quit lines are telephone-based support that provides immediate and continuous access for trying to quit. Today, we have explored the dangers of smoking, some of the prevention strategies for the youth, and cessation resources for the residents of the Shadowville community. Together, through the utilization of these tools and resources, a healthier, smoke free Shadowville is possible. If you need help quitting or know someone with a nicotine addiction, call 1 800 QUIT NOW or 1 800 784 8669. Thank you so much for your time today. I have the link embedded in the PowerPoint, but in the description box, I'll have a link to fill out a short and brief survey and questionnaire. Thank you so much for your time today.